Hello everybody, this is Dr. Rachel Brooks here, and we're going to talk today about the 5 major muscle deficiencies that are involved in low back pain. So a lot of low back pain is because of different imbalances in your posture caused by muscles that aren't engaged or firing properly. So we're going to do a couple demonstrations about these muscles on the table here. And so what those 5 muscles are going to be is your glute muscles. So those are going to be like right underneath the lower back around your hip area. We're going to talk about the psoas. So the psoas actually goes from like your lumbar spine all the way down in front of your pelvis and attaches in front of your legs. We're going to be going over your hamstrings. So those are just going to be on the back of your leg all the way down to the knee. Your quads, which are on the front of the leg down to the knees. And then we're also going to be over your tensor fasciae lata, which are kind of along the sides of the legs. So I'm sure a lot of you are already noticing that you have pain in a lot of these distributions. And a lot of times you do have pain in the line with muscles when they're not working properly. So let's go over the psoas first, because that's definitely the number 1 involved muscle in low back pain, because it is attached directly to the spine. So the psoas muscle hurts usually when you kind of stand up straight and lean back. So what this is going to kind of look like on the body is I'm going to bring his leg up, keep your knees straight. So I'm going to have him keep his leg up here while I push down. So as you can see with our patient here, hold here, this muscle is engaged properly. So that's going to hold his discs in place. That's going to make him able to exercise and function normally. Now we're going to go ahead and show him what a muscle that's not engaged looks like. So go ahead and hold this towards me. Hold this here. Hold. So that's what's going to be when it looks like when it's not working properly, or even some people. So some people try to hold this up here and just kind of let it fall. So some people can't even hold it up there on its own, and that's going to be a lot of times when you see even worse low back pain. So there's a lot of different things that we can adjust with chiropractic to get this muscle functioning, especially with the psoas. Seems it does directly attach to the spine. Just changing the alignment of the spine can really help with that muscle function. A lot of times going up as far as the neck, because the body communicates from the brain all the way down for every cell, tissue, and organ in your body through the nervous system. So getting anything between there and this muscle here can help this muscle function and heal properly and prevent or heal low back pain. So that muscle is number 1. Another one is the tensor fasciae lata. So that's going to be kind of along the front of the inside of the leg here. A lot of people will notice that they get pain just right in this area. So that muscle is going to look something like this. So hold this kind of up and out here. Okay, hold there. Good, and relax. That's going to be what that one looks like. Another one is the quadriceps. So that just goes all the way down the front of the leg, all the way actually in front of the knee. The quads tend to hurt the most when you're going downstairs. So anybody that has trouble going downhill, downstairs, this muscle might be a huge issue for them. So I'm going to go ahead and bend your knee. So hold this here, hold. So that's one area of your quad. However, there are many areas of your quad that can be dysfunctional. So try to hold this one towards the computer. Okay, hold there. So it can be the middle side, hold this out here. It can be the outside, and then hold it straight. Or it can be just right in front. Go ahead and relax. So any of those can cause pain like in and around your kneecaps. All right, this next one is going to be your hamstrings, which kind of go from the back of your knees all the way up to the back of your pelvic bones here. So go ahead and bend your knee. So I'm going to pull this out here and try to hold it in towards your bum. Hold there. Go ahead and relax. And just like with the quad, there's actually a few different parts of the hamstring. So the hamstring is the number 1 muscle that's confused with sciatica, because the distribution of pain is exactly the same for this muscle. It goes all the way down your butt cheek, all the way down into the back of your knees. So a lot of times people will think they have sciatica, but really it's just their hamstring is dysfunctional, not firing, or their hamstring cramps because maybe the pelvis is out of alignment, maybe they have a vitamin deficiency, or they're just dehydrated. Okay, so this next one I'll have you go ahead and flip over. So the last muscle, which is huge that I see a lot on people, is the gluteus maximus. So go ahead and bend this knee here. We're going to kind of bring this out to the side and hold this up. So he's going to hold this up towards the ceiling, and I'm going to push down. See, so his is engaged. A lot of people end up with issues in their glutes because in our society we're constantly looking up and forward, looking at cell phones, looking at computers, everything like that, which really throws your spine out of balance and kind of tends to shut down this muscle here. If this muscle is not working, you're not going to be able to do a squat. A squat is probably the #1 indicator of having like a long, healthy life where you're on your own and you don't need like a walker or a wheelchair or somebody around you to watch you all the time. So getting this muscle engaged is vitally important to your longevity. So those are going to be the top 5 muscles that we look at. We adjust the spine and many other joints from your heads to your toes to keep these muscles functioning and healing so that you can live a pain-free, happy, healthy, and active lifestyle.